That was a very quick overview and kind of synopsis of cannabis as medicine. Fundamentally, cannabis works with the endocannabinoid system of your body, and your endocannabinoid system is what keeps your body in balance or in homeostasis. You've seen a lot of examples of that. Is that right, Manny?
Absolutely. And working with patients, I've always get very personal, as even Amy suggested. It's really a one-on-one, and getting that feedback and learning that is different for each individual makes such a significant impact when we're trying to educate the general public, because it is really personal and it is different for each person.
Sure. So let's run through some of the questions that we've been asked prior to the webinar, and then we'll go to the questions that come up during the webinar. And by the way, if you still have some questions, please hit the Q&A button and ask us. That's what we're here for. We're really here to answer your questions and help you really take advantage of medical cannabis. First question is it good for Florida to allow large corporations to sell medical cannabis in Florida? What are the pros and cons of if Amendment 3 passes? That is a big question, a very important question. I'm going to take part of it, and I'm going to have you talk a little bit about this. I believe that we should allow not only large corporations, but small businesses to sell medical cannabis and to sell cannabis in general, just so that we're very clear about what cannabis is. Cannabis includes both marijuana and also hemp. And I believe that, especially now, you see a lot of hemp shops that are out there. What's interesting is that these hemp shops provide a cannabis product, especially CBD products that are very, very good for your body. And if you buy a THCA product from one of these locations, what you're able to do is you're able to use that product and be able to use it just, for example, as adult use. So 80% right now of cannabis is already legal. Let me put it to you that way. I think the question becomes the other 20%, what's out there. And so the question is, do I think it's a good idea for large corporations? And naturally, I think anybody should sell it. I think it's a bad idea to pull the small vendors out of the market, because small vendors is where you got a lot of your innovation. I think that's one of the things. I do not like the fact that the hemp market is being destroyed by this particular bill. And I really don't like the fact that it gives a complete exemption to the large corporations to do whatever they want without any recourse. And I do think we need to have guardrails on the large corporations. Your thoughts, Miney?
I completely agree with you on that, Mark. And to add on to it, excuse me, um, the having the larger corporations or the smaller mom and pop shops, if you will, sell cannabis is both mutually beneficial. The question boils down to whether they're doing it appropriately, they're sourcing their supplies adequately and appropriately, and they're doing things the right way. As far as the pros and cons of Amendment 3, pros of it for me personally is that it's a step in the right direction. The cons are how it's written and the loopholes that are there for big corporations to step in. So I'm really on the fence about it, but it could be a winner as long as we stay on top of it after the fact.
The biggest problem that I see with this particular bill is real simple. There is no language in the amendment that states and direct exactly what adult use cannabis is. And I say that because there's no provisions. It doesn't say adult use cannabis equals. All it says is that the state has 6 months to come up with a program. Now, let's be very candid. The lawmakers in Tallahassee are anti-cannabis. They've for years been trying to get rid of the medical program, which the people in this state passed. They're not listening to the people. They've tried to put THC caps on it. They've done whatever they can to restrict medical cannabis. And there are a number of representatives in Tallahassee that have come out and said that if this bill passes, they will produce the most stringent and most restrictive adult use cannabis program in the United States. So I don't think that leaving this bill up to the Tallahassee lawmakers is a good idea, and that's what this amendment proposes. There's no language in there that causes them or forces them to provide a program that listens to the people. I think that's one of the things that I just do not like about this bill. It does not give you home grow, which, as you know, is important for people, especially for veterans. Home grow is a very important part of this whole area. And I think the third and most important is it completely destroys the hemp market here in Florida, which I think is a very, very bad idea. This is a market that's been around for a long time. It helps thousands of people. CBD is a product that you don't need a medical cannabis card to get. but I do believe it's something that does help a lot of people. I recommend CBD as a first step for a lot of folks that are considering medical cannabis, and it's a very effective product. So I just don't like the way the bill is really, the bill is written, and I'll leave it at that. I'm just not. I just not feel comfortable with the bill. Any final questions or thoughts on that, Manny?
No, I think we covered that one enough, Mark.
There you go. Let's move on. Do you need to disclose to your employer that you take medical cannabis if they ask? And I think the answer is you should be very straightforward to them. If you obviously lie to your employer, it gives them cause to be able to fire you. They will probably find out that you're using it one way, shape, or form. They technically are not supposed to ask, but they do. And I think that one of the things that we should be doing, rather than a adult use bill, is pass a bill that allows people that have a medical cannabis card to be able to work in non-dangerous situations. I wouldn't recommend it for people that drive forklifts or drive trucks or something like that. But I think people that work behind the counter, customer service folks and things like that should be able to use medical cannabis. We do not have any provisions like that. It is not something that the legislature has taken up, again, because they're anti-cannabis. I think that's something that we should be able to do that. But I think you always should be very straightforward with your employer. And I know that in talking to a number of employers and talking to companies, they are actually moving away from testing and asking questions about medical cannabis, because what they're finding out is so many people use it that if they start doing that, they're going to lose a lot of their key employees. Your thoughts, Manny?
No, I completely agree. Always being forthcoming and upfront is beneficial, especially if you have a medical marijuana license in the state of Florida. Although there aren't any workers' rights or protections just yet, I've found most employers to be pretty straightforward with that. Again, unless you're a truck driver or otherwise, which is actually regulated by the federal government, therefore it is prohibited and you would have to surrender a Class A or Class B license in that instance. But otherwise, being forthcoming, being upfront, and as long as it's not a federal job, then it's usually pretty okay, if you will.
Right. And I know that one of the parties, and I'm not going to be political, I know Kamala Harris has come out and said that if she's elected, she will actually make sure that cannabis is legal here in the United States. And I think that's a major step forward. I think we've started the process, but I think having somebody committed to it is really going to be important to push it through the legislature, both the House and also the Senate.
On top of that, Mark, I just wanted to touch base on can they ask? The reason I believe that's a slippery slope is because it is federally illegal, therefore not considered a medical question against your HIPAA rights. However, in the state of Florida, it is medical, therefore it can be disclosed as that. But that's why it's a little tricky situation there, and being forthright is usually the best approach.
Sure. That's good question. Next question is a very good one. It says, my son has been prescribed Epidiolex, cannabidol, and for his seizures, can we use THC? Epidiolex is a synthetic cannabis that was made by GP Pharma. It comes out of the UK. It has been tested. It does have tests that have been done mainly in the UK. There is a couple of tests that were done here in the United States, but most of the process to make it legal has been done through research done in the UK. It is a effective product. I personally don't like synthetics as a product. I much prefer the actual natural plant itself because it has the whole product that are there, including the terpenes and the flavonoids. But it is very effective and has been shown very effective for seizures. And I do recommend that you use it for seizures. Now, can you use THC with it? The answer is you can, but I think it goes back to that dosing issue. You've got to make sure that your son, we got to know exactly how THC affects your son. And you've got to be very careful with that. I would consult your doctor, first of all, that's recommending Epidiolex. And the second is I would make sure that you go through a proper dosing process to make sure that you know the amount that he can take to get the right therapeutic dosing level. Your thoughts, Manny?
Actually, Mark, this one hits really close to home. So my son, who's 17 years old now, suffers from juvenile myoclonic epilepsy, or JME. For a long time, I was really trying to get prescribed Epidiolex for him, thinking it was more natural. And I had hit so many roadblocks that I found an easier approach to get him a medical marijuana card. And in doing so, I used high CBD products equivalent to Epidiolex, the difference being that it has terpenes and flavonoids. It has the entourage or synergistic effect And it relieved his seizures significantly, as if Epidiolex would have, I presume, because I never got to use it. However, the hurdle there is making sure that you have the exact same percentages, if you will, or milligrams batch to batch when you're dealing with the market or the medical marijuana market, which is very hard when you're dealing with that, and why there is that synthetic Epidiolex.
Hmm.
I wouldn't go as far as swapping out THC for Epidiolex. My son now uses Keppra, and he also uses marijuana products to balance out the Keppra, and it's very, very effective. He's a normal kid by any other measure, if not above and beyond what he needs to be for his age. So there's a lot of consideration, as you suggested there, Mark. You want to talk to your physician or your medical professional, and feel free to reach out. I would love to discuss this one with you as well.
Right, we'll give some information on how to reach Manny and his blunt joint organization to be able to help answer any questions you might have. And again, you do personalized consulting.
Absolutely.
Great. Okay. Let's grab the next question. It says, I'm searching for best pain relievers for arthritis without the high. What do you advise? Cannabis is great for helping people with arthritis. In many cases, what you're really looking for is something that has a pinene in it, linalool in it, myrcene, and beta caryophyllene. Those are the four terpenes that you want to make sure is in your product. And if they are in your product, they will help you, especially if it's a high CBD, low THC product. It'll help you address your arthritis, get rid of that inflammation, help you with the pain. And because it's high in CBD and low in THC, you probably won't get high with it. Although, again, it's important to go through that dosing process that's there. Your thoughts, Manny?
I completely agree. If you're really looking for no high or euphoric effects, high CBD products with those terpenes listed, I would go with B-caryophyllene first, as it's more of a natural pain or analgesic pain reliever, with limonene, pinene, and linalool.
Right.
Um, but one of the great things about the arthritis, and I hate to make it sound that way, is as miserable as it can be, is that arthritis, you can use a two tactful method, meaning you can use a topical specifically if it's a joint pain like rheumatoid arthritis or something to that effect, as well as taking an ingestible or inhalant or something where you're bringing it within the body. That way you have significant effect with longevity.
Sure, sure. I know that I have a number of patients that use arthritis, that have arthritis, and it's been very effective for them. And this is a good case where if you have a CBD product that's called a full spectrum means there's just a touch, 0.3% or less of THC in it, and that 0.3% basically boosts the healing properties of both the THC and the CBD. It helps a lot with arthritis, and it's a good first step. This is an example of where a good first step using CBD is something that you might want to try because there's little chance that you'll get high using the CBD products.
And then one caveat, Mark, is that if you are going with high CBD products, just be aware that it could take up to maybe 2 or 3 weeks to feel the full
Mhm.
effects and benefit of that CBD product.
Right.
You should feel benefits right away, but the
Mhm.
real impact will come a few weeks later as it preloads and loads into your body.
That's a good point. Yeah, it's not something where you take a pill and the next morning it's there. It's something that you're really going to use over a period of time that's out there. What combination of terpenes would help treat depression and anxiety as well as pain? High THC causes me jitters, chest palpitations. That's an excellent question. And this is a good case where what happens is that people perceive there are cannabinoids and there are terpenes. The medical healing property of cannabis comes from the terpenes, and a lot of people perceive it comes from the cannabinoids, but it really is something where when you mix the cannabinoids with the terpenes together, we call those cultivars. And there's a lot of products, there are a lot of cultivars being made today that what they do is they are designed for specific purposes like anxiety and stress or like pain. So I think that what you're looking for depression and anxiety, beta caryophyllene is one, myrcene is another. I think linalool is the third. Your thoughts, Manny?
Yeah, those are great terpenes. It also would depend on if you're looking for something for the daytime, the nighttime, what your activities are going to be. It really gets that detailed. What I see being described here, high THC causes me jitters, chest palpitations, and etc. Sounds like you were trying what we would call a sativa category product, meaning more of the daytime and uplifting. that was probably very high in limonene and alpha-pinene. And those two combined with high THC can cause the jitters, palpitations, paranoia, stress, anxiety. It really expands on that. So, and the important part to take away from that is it's the combination of the terpenes. I would start out with a moderate THC product or even possibly a high THC product with just limonene and very little to no pinene, and then maybe some B-caryophyllene in there as well for the
Sure.
pain. And that should be a nice balanced daytime product that won't give you the jitters or the anxiety. If you're
Good
looking for
point.
the evening or the nighttime, you would switch out that limonene with the myrcene and or linalool, and that will help relax you and help you digress from whatever you're dealing with.
Right. And there was a link there. Lee put a really good link there to be able to show the a webinar that we did on anxiety and stress. And please feel free to click on that link or go to our YouTube channel, which is YouTube/marijuana aware, and you'll be able to find that particular webinar or that particular video on how anxiety and stress, cannabis can help with anxiety and stress. What is a good route to use in the middle of the night when I wake up and can't fall back asleep? This is a classic case of why you'd want to use edibles. Manny, you going to take that one?
Oh, I would love to. I would like to suggest, how about we mitigate you even waking up in the middle of the night and hopefully getting you to sleep and through the night. And to your suggestion, Mark, that's where I would use edibles, and or orals, depending on the type. Sublinguals would be kind of okay depending on your timing, but sublinguals won't possibly carry you throughout the night, whereas a chocolate, a capsule, a gummy or something to that effect will help keep you asleep through the night. However, if you are waking up in the middle of the night, you do not want to take an edible in the middle of the night as it can keep you asleep through the morning. So I would suggest an inhalant like a vape, or if you're into flower, you could smoke a bowl or maybe a couple of puffs off a joint to help you get back to sleep on an indica category strain, high in myrcene, linalool, and B-caryophyllene.
Right. Here's a link, by the way, to a falling asleep and staying asleep webinar that we did. You may want to take a look at that one. Let me point out that when you take an edible, edibles basically go into your stomach and are absorbed into your stomach. And that process of going through that can take anywhere from a half hour to up to 2 hours before it actually works. So be very careful when you get using edibles. Don't pop them like Skittles. Otherwise, you'll find out that you may be taking too much. When you take one, wait about 2 hours to see how it actually affects you. Now, that's the downside of edibles. The good side of edibles is they'll last between 8 to 10 hours. So, for example, for myself, I'm a chocoholic, and so what I like to do before I go to bed is I'll take a little tab or two of chocolate, chocolate bar, or what I found out lately is my wife makes me what she calls happy brownies, which I'll have a chocolate brownie before I go to bed and wait about an hour before I go to bed, take my brownie, and I sleep through the night. It works out very well for me because, again, it gives me that 8 to 10 hours of use that's out there. So I'm not waking up in the middle of the night. And I think that's something that's very, very important. That's something that you've seen with some of your patients, right, Manny?
Absolutely. And one of the tricks I actually advise anybody who's looking to use edibles to go to sleep, or edibles at any time for that matter, I always suggest to kickstart your metabolism. And what I mean by that is if you know you're about to have a big meal, take your medicine and then have your big meal. If there's no meal in sight, or if it's just before bed, you don't really want to go to bed on a full belly. Maybe a little small cup of yogurt, a spoon of peanut butter, or something with natural fats or anything fatty. I'm just an kind of a nutritionist in that aspect, and that will help kickstart your metabolism. And not only that, now you have something fatty because cannabinoids are a fatty molecule or are attracted to fatty molecules, and it'll attach and get absorbed faster and more efficiently within your body for a more significant effect.
Hmm. Yeah. And here's some charts that really help you with both the what they call the route of administration, how long it takes for it to take effect, and how long it actually works. So you can see that edibles take some time to work, and capsules fall in the same category, but they work also a long time. You can see the one that's on the right and the one that's on the left. So hopefully it answers your question, but I would stick to an edible. And I would actually take a look at this webinar because this is done with Dr. Greg Holt, and he's an advisor on sleep, can help you quite a bit in this particular area. Let's move on to the next question. And I think this is one, Manny, that falls right up your alley. How can cannabis help with traumatic brain injury? Being in the service, you've seen a little bit of that. 'Cause.
I've seen quite a bit, and I've had a few friends. Um, brothers and sisters in arms that have had TBIs or traumatic brain injuries and actually use medical marijuana to assist with them. I can't speak directly to it. However, anecdotally and speaking with them, most of their stories all have one similarity, and is that marijuana and cannabis helps them focus on it. It kind of takes away the shades, if you will, and helps them come to terms with what they're going through and understanding. The other benefit of it is that it's a neuroprotectant. So if anything, it'll help further degradation of anything that's coming from the TBI or traumatic brain injury and possibly quite help heal it. Although again, there's no claims or any significant peer study groups that have actually been able to make that claim just yet.
Mhm. Well, I know they're doing some studies on this right now, and they're in process. But anecdotally, as you mentioned, for years, it's been very cannabis has been very effective with traumatic brain injury, not just in the recent histories, but even 100 years ago during the Civil War, they were using cannabis to help people with what was called shell shock, is what we called it years ago. So, yeah, the answer is yes, it is effective. This is where you want to talk to your medical cannabis doctor. They can help you quite a bit in this particular area. And again, the other side of it is you getting the dosing right. I think that's an important part of this, Manny.
Absolutely. Dosing and everything, in every scope of cannabis, whether it's inhalant, oral, sublingual, topical, edibles, you always want to make sure you get that dose right. And as you and Amy suggest in this in the snippet, always try to start low, go slow, find your sweet spot.
Right. Next question is a good question. It says dizziness over years from RX and ear virus. Any products for this? Manny, I'm not familiar with any products. Your thoughts?
I am not particularly, my only suggestion to this would be possibly high CBD products with alpha pinene and limonene because they do have antimicrobial and antiviral properties to them. And then possibly using something around the ear, not in the ear. You don't want to put any cannabis products. There's none available for that just yet in the ear, but maybe around the ear that might help. But these are really far out there suggestions because I've never run into this one before.
Yeah, I've not seen any studies on this, and I don't want to give you advice on something we don't have any science on. But I think your advice is correct. By the way, when you talk about using it around the ear, you're talking about using a tincture, excuse me,
No, you're right. A tincture, a couple of drops of tincture just
right.
around the ear. We do that for migraines and headaches, and we found that to be effective.
Right. And it might work in this particular area. And again, that's just a far out thought that's out there. I don't know of any research that's done. Hopefully it'll be done in the future. Next question is what OTC over the counter medication does cannabis complement and which might interfere and interact with them? I'm not familiar with, I think cannabis really complements almost everything except for heart medications. Manny, you want to dive into this one?
Yeah, so there's again, I'm not a medical professional, but I do work with quite a few medical professionals, and I'm always picking their brains, translating their jargon into what's lay terms for us consumers and persons of interest. So, and what I found is that other than heart medication, which is even very limited, but more importantly, CBD with blood thinners, primarily pre and post surgery because it's a natural diuretic. It kind of opens up the blood vessels a little bit more. And if you're already on blood thinners, you don't want to have your blood pressure drop too low, primarily before or during surgery or even after. So those are the only ones I know of. There is a Penn State. I'll get that link for you, Mark. I think we went over this one time in another
Right.
snippet where Penn State has a contraindication kind of glossary where you could put in your medication what you're doing, and it'll kind of tell you if there's any contraindications or mixtures that you shouldn't be having there.
Great. We'll put that in the follow-up email that you get. We'll put that link in there so you can take a look at it and and see what Penn State has to say on this particular subject. I'm glad they've done some research in this particular area that's out there. Next question is, does marijuana help with rheumatoid arthritis pain? Manny, go for it.
Yeah, I was just talking about this one a little earlier. It absolutely does. There's not much that marijuana or cannabis does not help with. It's just a matter of the route of administration you're willing to use, what time of day, what your work ethic or your retirement or your family demographics look like, and how to apply it. But I would recommend a topical like a salve or a lotion. Salves are a little bit better because they penetrate deeper. If I'm not mistaken, Mark, correct me if I'm wrong, RA or rheumatoid arthritis is more likely to be in the joints, which is why I recommend those salves to actually penetrate a little bit deeper. And then you could
Sure.
use a tincture, you could use a vape, you could use all different types of routes from high CBD to high THC. It's about that consultation, and or you could talk to somebody at the dispensary just to have a consultation without even buying anything, so you could get an understanding on what will work.
Yeah, I think that's a good advice. Is almost all dispensaries will do what they call a consultation, and I highly recommend that you get one of those, especially for this area. But when it comes to rheumatoid arthritis, I've seen a lot of success in this area. You're right; it's in the joints, and topicals work great. I also find that if you're using a tincture or any other route of administration, make sure that you have in there beta caryophyllene, myrcene, and linalool. Those are the three that are going to help you with that particular condition that's there. Manny, I think the next one, you being a vet, you can help with this. It says, I'm a Navy vet. I'm 100% disabled, and I wonder how long the VA will continue to see me and other veterans like me. Uh, Manny, you take that one. I don't think they're going to stop seeing you. Your thoughts?
No, they're definitely not going to stop seeing veterans. And actually, it's progressing to where, at least now, the physicians at the VA can have discussions. They just can't recommend or prescribe anything, regardless of the state statutes or laws. And we're hoping that's going to be changing soon, where they can, but they should at least be having discussions. I know I still run into a lot of fellow veterans where they run into interference, or the medical professional suggests that if they get a medical marijuana card, then they're just going to cancel all their scripts and all this other nonsense, which could be very dangerous and it's very unethical. If that does happen, please talk to your VA liaison. They are cracking down on this and they are being more open-minded. And I would highly recommend checking out va.gov website for more information, because they're updating it. I can't even keep up anymore. I used to check it at least quarterly. Now I got to check it almost every other week for new updates. And that's where you'll find the most beneficial information.
I know there's a move afoot, especially in the VA and with the federal government, to be able to really put cannabis into the pharmacopoeia of the VA. I think there's been obviously some politics going on, and hopefully with the election, we'll see that really open up and see more, let's just say, openness with respect to the VA and cannabis. We'll see how that all works out.
I'd also like to clarify, Mark, just in case I don't want to miss the question here. As a veteran, as long as you're in a state that is legally medicinal and or recreational, you cannot lose, or you will not lose, any benefits by using medical marijuana, as long as you're properly licensed, or if you're in a recreational state and otherwise. And if that threat does come down again, please talk to your liaison or even talk to your congressperson, so we can get this eliminated and get the treatment that we deserve.
Yeah, that's a good point. That's an excellent point. It's really there. Okay. Um, Are there various terpenes for the treatment of PTSD? I call it PTS because I don't think it's a I just like to drop the D. Manny, this is again one of the questions right up your alley.
Yeah, this is one I've suffered from for quite a while, and I still do from time to time, depending. Terpenes are kind of tricky on this one, because when you're dealing with PTS or PTSD, as is shown here, terpenes can really, or not just the terpenes, but the cannabis product can actually really have you confronting what your anxiety or your stress or your traumatic issue may have been. And if you're not prepared for that, then it can send you in a little spiral, although not very detrimental. It's just hard to deal with. Some of the terpenes I particularly look for the daytime would be limonene. As I acclimate to limonene and possibly B-caryophyllene, then I introduce alpha pinene to it. And as I stated before, limonene and alpha pinene combined can kind of induce anxiety if you're not really prepared for it. One things you can do, or one of the things you can do to mitigate that, is write yourself a little note, have your hobby that you like to do readily available if possible, because if that does occur, you could read this little note that you wrote to yourself, or engage yourself into something that you enjoy doing, and that'll subside. And the more you use it, the more your body is going to become acclimated to it and build a tolerance to that without neglecting the effect of how it's helping you.
Mhm.
So limonene, pinene, and B-caryophyllene during the day. At night, especially for sleep, I usually look for something very heavy in myrcene. Myrcene is that one that really couch locks you. It also allows THC to get to the brain a little bit more efficiently, therefore creating a more euphoric effect and helping you to get that couch lock effect and hopefully going to sleep as an inhalant. If you're ingesting it, I would highly recommend, again, high in myrcene, although terpenes, when you're ingesting it, this is another story for another time, kind of get destroyed in the stomach, but high THC with something fatty, so that way you can stay asleep and not have to deal with any of that traumatic issues you're dealing with through your dreams or nightmares.
Sure. That's good. Good question. Another question is, where can I find info on cannabis and autism? That's an excellent question. I'm going to kind of give you two sources that I know are pretty good. Canamoms in Texas has a whole section on autism and cannabis, which they use for the kids that they're taking care of. Again, it's called Canamoms of Texas or Texas Canamoms, and they'll give you some information on this particular subject. The other is there's a doctor here in Florida named Dr. Bergen. He does some YouTube webinars, actually YouTube videos as well as webinars. And you might want to take a look at him. He's a specialist in autism, and he's put out a couple of videos on this particular subject. I'd recommend that you take a look at him. Let's kind of jump into the questions that were asked during the webinar itself. And Carolyn asked, I've been using medical marijuana for almost a year in an attempt to alleviate my rheumatoid arthritis and arthritis pain. So far, nothing relieves the pain, but it does help me sleep. Any suggestions? Carolyn, I think the issue here is when you use cannabis, you got to really pay attention to the terpene profile. If you don't have the right terpene profile, it's not going to really help you very much. And again, the terpene profile to help you with our rheumatoid arthritis is beta-caryophyllene, myrcene, and linalool. I think that's going to be something to pay attention to. Check the product that you're using and make sure you're using products with that's there. Manny, any other thoughts on this particular subject?
Just a couple. Actually, I apologize that you're dealing with this. I can imagine how much pain you're dealing with. But I would also advise using a topical, particularly a salve or something thicker than a lotion. And if you're using products, because I would have to ask, what are you using? Where are you getting it? However, if you're being told, oh, or you're telling them I'm in pain and they're responding, okay, here's an indica category product, that suggests that you're getting good sleep, but it may not be alleviating your pain. One of the highest terpenes, the best terpenes for pain is going to be B-caryophyllene, and then the myrcene for nighttime and limonene for the daytime. And then using that topical, I think using that two-way approach may help significantly.
Yeah, I think that makes a lot of sense. Great. Let's run into the next question. It's there. Next question is, I realize terpenes make a big difference when looking for a specific product that will help with your issue. But so many dispensaries do not tell me what terpenes are in their product, or literally have you scroll through their products and go into the descriptions to see the terpenes that are, and many times they aren't even there. Any suggestions? First of all, work with dispensaries that tell you what their terpenes are. I know there are certain dispensaries that don't, and I would not use them, candidly. I know sometimes to make these terpene profiles available to the public, it's a bit of an issue. I know, Sotera, you've went through that quite a bit, but you have made them all available now. And keeping up on that is something that's really important. But I think it's important that you do take a look at the terpene profiles that are there. Finding these are a pain in the tail. I know, and you do have to go through a number of the products. One of the things I recommend is, rather than doing all the legwork, schedule a consultation with that particular, if the dispensary has or is presenting terpenes with their products, get a consultation. Let them do the legwork for you. And they'll come out and the consultation doesn't cost you anything. I think the second is that what you want to be able to do is you want to be able to talk to your medical cannabis doctor, because in many cases he'll know some of the products that'll work in that particular area. Your thoughts, Manny?
I completely agree. I would go also a step further and suggest that you don't even have to schedule a consultation. You could just walk in and request a consultation. By state law, all dispensaries have a consultation room in case you do want privacy during these consultations. And you can always ask for a certificate of analysis at any dispensary for any product that you're purchasing. And if it should have terpenes in it, depending on the product, it should be listed on the certificate of analysis. I would also, against my better judgment, to save the dispensaries a little headache, keep in mind that for a while now, a lot of people in a lot of dispensaries were always about the THC percentage. Terpenes have just become the next greatest thing in the past probably year and a half, 2 years, where people are starting to realize that terpenes are really driving the bus. And as such, dispensaries are jumping through hoops to get their software up to date in order to present these terpenes online or make it readily available at least. And then the other caveat to that, to include THC percentages, is that keep in mind that all products at every dispensary is a live product grown in the state of Florida, from seed to sale to how it gets to your bag. And as such, everything changes. It's not always consistent. So if you get something different or is presenting a certain percentage, let's say it's presenting 30% online, but then you get to the store and it's only 23%, maybe that batch sold out, or maybe they have mixed batches, or
Right.
something may not have caught up quite as fast. This is a very rapid moving market. And I only say that to suggest showing a little heart and kindness to these people that are hopefully taking the pride in their craft to try to assist you in a better quality of life.
It's a botanical product, and one plant to the next plant will vary slightly. And that's one of the things you really got to pay attention to, is being able to do that. And I know the medical cannabis dispensaries, the ones especially that present the terpenes, are very serious about putting out a quality product that's really out there. And I'd say pay attention to that. I'm going to throw a little caveat, a little teaser out. Next quarter, we'll have an answer to your question. It's going to make it a lot easier. We've been working on a project for 3 years to get you the answer to that easily, but we'll leave that as another webinar and another announcement coming in the future. But we're close. We're close. We're getting closer. I've been saying that for 2 years, so we'll see how that works out. But no, seriously, we're looking at something to help people with terpenes, especially if the amendment passes. A lot of people are going to be trying to figure out what product to use, and I think we're going to have a solution for that. Um, it's there. I think we've run through most of the questions. By the way, if you do have any questions, please bring them in. We'll be more than happy to answer that. Manny, do you have any final thoughts and comments?
I just hope that we were able to reach some people. It's always a pleasure, Mark. Thank you for having me. I know you're going to give shout outs to Leah and Lee later, but I want to give them a shout out for once this time, as I usually don't. So thank you, Lee and Leah. And I hope to be back next week and educate some more.
Sure. Cannabis is medicine, and I hope this has helped you understand a little bit more about it. We tried to present it in a form that just didn't overwhelm you, although some of it might have been that way. But please treat it that way. It's something that's very important, and it is effective. It works for a lot of folks. Manny has seen in his practice a lot of folks. And by the way, if you do need one-on-one consultations and you want to, type down in that, please get a hold of Manny and his blunt joint organization. They're very good at what they do. That's why I have them on this particular program. And I want to thank you, Manny, for what you do. Not only to help me with the webinars, but what you do in general. It's something that's really needed today in this market. People need answers to questions to help them with cannabis. And cannabis is a very effective medicine, has been a very effective medicine for a long time. So thank you very much for joining us. I hope you have a good evening, and hopefully everybody will stay safe and we're through with the hurricanes.